Hi, my name is Matt Murphy. I'm an assistant professor of both medicine and public health at Brown University and a long-term collaborator at the Andalusian School of Public Health in the University of Granada, particularly in the European Masters of Public Health program. But at Brown University, my area of work focuses on protecting and promoting the health of populations that are impacted by incarceration. Populations that are incarcerated are among the most vulnerable populations that live in our communities. These are groups that are often racial and ethnic minorities that are impacted by severe substance use and mental health conditions, that have limited access to financial and legal resources to both avoid incarceration as well as address some of the root causes that linked to individuals' health that lead folks to be incarcerated and to have encounters with the criminal legal system. As a result, when folks are incarcerated, as well as when they return to the community, they're impacted by a number of intersecting, oftentimes severe health conditions, while also experiencing a number of barriers to addressing those health conditions and accessing the required health services that they need. As a result, developing interventions and tailoring health services to these populations are critical, not just for their own health, but also for the larger community health, addressing the epidemics of substance use, HIV, hepatitis C, a number of different intersecting health conditions that run through and cross through carceral systems, both in the United States and globally. And this impacts nearly every country throughout the world in different ways, sometimes with different diseases, but in very, very similar ways. More specifically, my area of work, both clinically as a physician, as an internal medicine physician, as well as a researcher, focuses on the prevention of HIV. There are a number of different approaches to preventing the exposure to and acquisition of HIV that are incredibly effective, that have been developed over the last 40 years. But perhaps most exciting and most promising and most effective is an approach called pre-exposure prophylaxis, where individuals and populations that are at greatest risk for exposure to and acquisition of HIV are able to and are prescribed a medication that they can take before they're potentially exposed to keep them protected. We know that this is an incredibly effective way at preventing HIV. We also know that it's incredibly feasible and of great interest to populations that are vulnerable. Oftentimes the greatest challenge is making sure that we deliver the care that's in a way that's accessible and adapted to individuals and communities that are at greatest risk, including folks that are incarcerated or are at risk of incarceration. Our own work at Brown University and in Rhode Island has shown that, particularly for PrEP and the prevention of HIV, that it is both feasible and of great interest to populations as they're experiencing incarceration and as they return to the community, and that there's also an incredible need. What's incredibly exciting and motivating as a researcher is not only working, and as a clinician, is not only working on individual clinical care and clinical programs that have direct impact on an individual's life, but also generating knowledge and collecting data and evidence that can be used in other places to help facilitate similar sorts of services and interventions elsewhere. I'm incredibly excited about what the future holds for the prevention of HIV and the use of PrEP, particularly with the availability of long-acting injectable formulations. And I think we have some incredible tools to end the HIV epidemic, but we really need a commitment to and support of our most vulnerable populations, including those that are impacted by incarceration.